and we want to be able to immediately move it into place without going and taking it. So we're ready to go, and we've also distributed. I just spoke with Governor of Michigan, had a great conversation, and we sent a large number of ventilators to Michigan. We're sending them to Louisiana. We sent additional ventilators to New York, additional ventilators to New Jersey. And I will say, in New York, FEMA is supplying 250 ambulances and 500 EMTs to help respond to the increasing caseload. That's a lot of ambulances. In California, the Army Corps of Engineers is developing 8 facilities to expand hospital capacity up to 50,000 beds, 50,000. And had a great conversation last night with Gavin Newsom. He's doing a really good job. We're in constant communications. The USNS Mercy hospital ship is now operational. It's in Los Angeles and receiving patients. And in New York, as you know, the Comfort, everybody watched that. It's in place and will be in a very short while receiving large numbers of patients, over 1,000 rooms and 12 operating rooms. FEMA has also provided 100 travel trailers to assist with housing needs, and we're ordering hundreds more. In Michigan, FEMA will soon deliver, in addition to the ventilators, 250-bed field hospital, and Army Corps of Engineers is evaluating locations to build alternate care facilities. So we're doing a field hospital in Michigan of 250 beds, and we may be doubling it up soon, depending on the need. They're doing a good job with beds in Michigan, but they may need more than the 250. So FEMA and the Army Corps of Engineers are prepared to go there quickly and get it done. In Louisiana, we're delivering 2 field hospitals to provide 500 new hospital beds. I've been talking with the governor, John Bell Edwards, and the Army Corps of Engineers has been really doing incredible work, establishing 3,000-bed alternate care site at the New Orleans Convention Center, which will be operational, believe it or not, this week. So we're doing a 3,000-bed alternate care site, and we're also doing a 500-bed new hospital. And that's in Louisiana, which really got hit. It started off very late, and it was looking good, and then all of a sudden it just reared up, came from nowhere. In addition to the supplies we're delivering, we're also giving hospitals the flexibility to use new facilities, including surgical care centers, to care for hospital patients who are not infected. For example, I know that many expectant mothers are understandably concerned about exposing their newborn babies to the virus, and they should be. With our action yesterday, hospitals now have the authority to create special areas for mothers to deliver their babies in a very safe and healthy environment, totally separate. Over the past 2 months, the U.S. State Department has organized one of the largest and most complex international evacuation operations in American history. Mike Pompeo has been working round the clock, along with Ambassador O'Brien. Since January 29th, we have successfully repatriated over 25,000 Americans from more than 50 countries where they were literally stuck, in some cases locked in. And I salute the incredible public servants at the Department of State, as well as their counterparts at DHS and HHS, who have played such an important role in doing this. You probably read about the young people in Peru and young people in Brazil, and they were absolutely stuck, and we got them out, got them. Almost everybody is out now, back home with their parents, their wives, their husbands. I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. when you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible. I was watching last night Governor Murphy of New Jersey say 29 people died today, meaning yesterday, and others talking about numbers far greater. But you get to know a state. I know New Jersey so well, and you hear 29 people, and hundreds in other locations, hundreds in other states. And this is going to be a rough 2-week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better all of a sudden. And it's going to be like a burst of light, I really think, and I hope. Our strength will be tested and our endurance will be tried, but America will answer with love and courage and ironclad resolve. This is the time for all Americans to come together and do our part. I appreciate a lot of the media. We've had a lot of really good things said. I think only good things can be said when you look at the job that's been done. I just spoke with Franklin Graham, who's an extraordinary person, and Samaritan's Purse has been, like so many others, just been amazing and so fast. They did it so fast. He's been doing that for a long time, but I think people are really seeing what they have done. Franklin Graham, very special family. As we send plane loads of masks and gloves and supplies to the communities battling the plague, and that's what it is. This is a plague. We also send our prayers. We pray for the doctors and the nurses, for the paramedics and the truck drivers and the police officers and the sanitation workers, and above all, the people fighting for their lives in New York and all across our land. I watched as doctors and nurses went into a certain hospital in Elmhurst this morning. I know Elmhurst, Queens. I grew up right next to it. I know the hospital very well. Been seeing it all my life, my young life. And I will tell you that to see the scenes of trailers out there and what they're doing with those trailers, they're freezers, and nobody can even believe it. And I spoke to some of my friends. They can't believe what they're seeing. And I watched the doctors and the nurses walking into that hospital this morning. It's like military people going into battle, going into war. The bravery is incredible, and I just have to take my hat. I would take my hat. If I were wearing a hat, I'd rip that hat off so fast, and I would say, you people are just incredible. They really are. They're very brave. They're going in, and they don't know. You have lots of things flying around in the air. You don't know what you're touching. Is it safe? And you also see where you have friends that go into the hospital and you say, how is he doing 2 days later? And they say, sir, he's unconscious or he's in a coma. So things are happening that we've never seen before in this country. And with all of that being said, the country's come together like I've never seen it before. And we will prevail, we will win, and hopefully it will be in a relatively short period of time. With that, I'd like to ask Dr. Birx to come up and show you some of the latest, just the data that has been, I think, brilliantly put together. And right after that, I'm going to ask Dr. Fauci to speak. And Mike Pence is going to give you some of the recent events that have taken place and some of the statistics that we have that I think will be very interesting here. Thank you very much. Please, Dr.
Thank you, Mr. President. If I can have the first slide, please. So always, and that's what this slide is labeled, is goals of community mitigation, really highlighting that this begins in the middle and the end with community. It is community and the community of the American people that are going to have to do the things for the next 30 days to make a difference. I think you know from that large blue mountain that you can see behind me, and I just want to thank the 5 or 6 international and domestic modelers from Harvard, from Columbia, from Northeastern, from Imperial, who helped us tremendously. It was their models that created the ability to see what these mitigations could do, how steeply they could depress the curve from that giant blue mountain down to that more stippled area. In their estimates, they had between 1.5 million and 2.2 million people in the United States succumbing to this virus without mitigation. Yet through their detailed studies and showing us what social distancing would do, what would happen if people stayed home, what would happen if people were careful every day to wash their hands and worry about touching their faces, that what an extraordinary thing this could be if every American followed these. And it takes us to that stippled mountain that's much lower, a hill actually, down to 100 to 200,000 deaths, which is still way too much. Next slide, please. Simultaneously, there was a modeler out of the University of Washington that modeled from cases up, utilizing the experience around the globe to really understand how this information that we have from Italy and Spain and South Korea and China could really help us give insight into the hospital needs, the ventilator needs, and really the number of people who potentially could succumb to this illness. It is this model that we are looking at now that provides us the most detail of the time course that is possible. But this model assumes full mitigation. It's informed every morning or every night by the reality on the ground coming in from New York, New Jersey, and around the United States, and is modeled and informed every morning so that it is adjusted so it is up to date every day. This is the model of the predicted fatalities and mortality in the United States. And as the president said, it's very much focused on the next 2 weeks and the stark reality of what this virus will do as it moves through communities. Next slide, please. But this is a slide that gives us great hope and understanding about what is possible. On the bottom of the slide, where you can barely see that blue line at the very bottom, that's the current cases in California, the cumulative cases in California, where they're doing significant testing. The next line up is Connecticut. The orange line is New Jersey. The blue line is New York. The yellow line is Washington. We all remember Washington State. It was just a month ago when they started to have the issues in Washington State, but they brought together their communities and their health providers, and they put in strong mitigation methods and testing. And you can see what the result in Washington State and California is. But without the continuation for the next 30 days, anything could change. Next slide, please. So I'm sure you're interested in seeing all the states. So on this slide is all 50 states and the District of Columbia. But I think it shows in stark reality the difference between New York and New Jersey and other states with similar populations and urban areas. Our goal over the next 30 days is to ensure the states that you see, the 48 across the bottom, maintain this lower level of new cases with the hope that we don't have significant outbreaks in other states and other metro areas as the community comes together to work together and ensure that the healthcare providers around the globe and in the United States are strengthened by our resolve to continue to mitigate community by community. This is done community by community. We all know people are in their states and in their communities. And we're very dependent on each person in the United States doing the same thing, following the presidential guidelines to a T. I know it's a lot to ask because you've done it for 15 days. So if you can show the next slide, please. So this is what gives us a lot of hope. This is the case finding in Italy. And you can see that they're beginning to turn the corner in new cases. They're entering their 4th week of full mitigation and showing what is possible when we work together as a community, as a country, to change the course of this pandemic together. It is this graphic and the graphic of many of the states that gives us hope of what is possible with continuing for another 30 days. Amidst all that hope, I must say that like we warned about Detroit and Chicago, we start to see changes in Massachusetts. New Orleans continues to be a problem of new cases, although they're stabilizing. And I think it really shows the depth of dedication of the American people to the healthcare providers, because they can see the strain that this puts on every nurse, doctor, respiratory therapist, pharmacist, and laboratory technician that's working together to stem this tide of unrelenting sick people coming to their doors. No one has been turned away. No one who has needed ventilation has not received ventilation. But you can see how stressful it is for each of them. So I know it's stressful to follow the guidelines, but it is more stressful and more difficult to the soldiers on the front line. As we started and we will end with its communities that will do this, there's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days. Thank you.
Thank you very much, Dr. Birx. Mr. President, Mr. Vice President. So what Dr. Birx has really said very simply is that there are really two dynamic forces that are opposing each other here. As I've mentioned several times in our briefings, the virus, if left to its own devices, will do that dark curve that Dr. Birx showed you. The other dynamic force is what we are doing, what we're trying to do, and what we will do in the form of mitigation. Now, these are very revealing bits of data, because you saw what happened in Italy, where you make the turn around the curve and you go. That doesn't happen all at once. It's a stepwise fashion. And if I explain the steps, which I will, you'll see why we are really convinced that mitigation is going to be doing the trick for us. Because what you have is you have an increase in new cases at a certain rate. When the increase in new cases begin to level off, the secondary effect is less hospitalizations, the next effect is less intensive care, and the next effect is less deaths. The deaths and the intensive care and the hospitalization always lag behind that early indication that there are less new cases per day, the way we saw in Italy, and the way we're likely seeing, I don't want to jump the gun on it, we're seeing little inklings of this right now in New York. So what we're going to see, and that's we got to brace ourselves, in the next several days to a week or so, we're going to continue to see things go up. We cannot be discouraged by that, because the mitigation is actually working and will work. The slide that Dr. Birx showed, where you saw New York and New Jersey, and then the cluster of other areas, our goal, which I believe we can accomplish, is to get the hotspot places, the New Yorks, the New Jersey, and help them to get around that curve. But as importantly, to prevent those clusters of areas that have not yet gone to that spike, to prevent them from getting that spike. And the answer to that is mitigation. Now, the 15 days that we had of mitigation clearly have had an effect, although it's tough to quantitate it because of those two opposing forces. But the reason why we feel so strongly about the necessity of the additional 30 days is that now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope and I know that we can do over the next 30 days. And as I said the other day and on one of the interviews, we are a very strong and resilient nation. If you look at our history, we've been through some terrible ordeals. This is tough. People are suffering. People are dying. It's inconvenient from a societal standpoint, from an economic standpoint to go through this. But this is going to be the answer to our problems. So let's all pull together and make sure, as we look forward to the next 30 days, we do it with all the intensity and force that we can. Thank you.
Thank you, Mr. President, and to Dr. Birx and Dr. Fauci. I know I speak on behalf of the President and people all across this country when I express our great admiration and appreciation to both of you for helping to steer our nation through this challenging time. The American people have now seen what the President saw when he made the decision at the end of 15 days to slow the spread, to ask the American people to give us 30 more days, to continue to put into practice the President's coronavirus guidelines for America. And as you just heard from the experts, we have reason to believe that it's working. As Dr. Fauci just said, there are difficult days ahead. Our hearts and our prayers go out to the families that have lost loved ones, and those, as the President just reflected, who we know are struggling at this hour in hospitals across the nation. But to each and every one of us, do not be discouraged, because what you can do to protect your health, the health of your family, what you can do to ensure that our healthcare providers have the resources and our hospitals have the capacity to meet this moment is put into practice the President's coronavirus guidelines for America. It really is what every American can do. 30 days to slow the spread, 30 days to make a difference in the lives of the American people, American families, and the life of our nation. Allow me to give you a few brief updates before the President takes questions. First and foremost, we continue to work very closely with governors around the nation. The President and I spoke to all the governors, all the states and territories yesterday. And since we were last together, the President and I have spoken directly to several governors around the country, including Illinois, Louisiana, Michigan, New York, and other states. At the present moment, the President has declared 29 major disaster declarations and authorized 10 different states to use full federal funding, so-called Title 32 funding, to pay for their National Guard. And as of this afternoon, FEMA reports some 17,000 National Guard have been activated in states around the country to provide support for coronavirus response. On the subject of testing, we have now completed more than 1.1 million tests around the country. We're working very closely with governors around America to assist them in drive-through and community testing centers. I spoke with Governor J.B. Pritzker of Illinois today about a testing center that they've established in cooperation with the U.S. Public Health Service. We remind every governor and every laboratory and hospital in the country, it's imperative that you continue to report daily to the CDC the results of those tests.
News 4 at 5 starts now.
And good evening, everyone. Welcome to News 4 here at 5 o'clock. Mayor John Cooper is proposing what he warns will be a substantial property tax increase.
He made that announcement under some unusual circumstances, as News 4's Nancy Amons tells us. Nancy?
Well, normally, as you know, the mayor gives his annual State of Metro address to a big audience, but today everything was online, and he shared some news that wasn't completely unexpected. A tax increase is on the horizon.
Let me explain why we are here and why you are there.
Vice Mayor Jim Schulman introduced the mayor in an empty council chamber, protecting the public from the spread of COVID-19.
2 of the 4 or 5 worst disasters in the 238 years of Nashville history happened this very month.
A tornado, then the coronavirus. They all hit at a time when the city's finances were in such desperate shape that the comptroller had threatened to take action. When the virus hit, it emptied Nashville's streets, the bars, and the hotels. Sales tax revenues tanked, and they make up 20% of Metro's income.
The Finance Department estimates that for the remainder of this fiscal year, ending June 30th, revenues from sales taxes and other activity taxes will be down between $200 million and $300 million. And that estimate is just for the fourth quarter of this fiscal year.
That money has to come from somewhere, and it's likely to come from homeowners.
We can't print money or borrow to cover our operating expenses. We must raise property taxes, as difficult as that is right now.
The mayor's announcement drew applause. 2 or 3 attendees in the empty council chamber, bringing home the point just how much impact the virus has had on Nashville. Now, this proposal to raise taxes goes to the Metro Council probably at the April 28th meeting. The mayor says the city is not losing its vision, all the things it wanted to do, the teacher pay raises, the affordable housing, the police body cameras. But he says the important thing right now is saving lives. Tom?
Nancy Ammons live. Nancy, thanks. New details following the cancellation of CMA Fest this year because of the coronavirus. The Convention and Visitors Corporation saying last year the event brought in $65 million to the city. This morning, the mayor estimated a loss to the city between $200 and $300 million. We ask if that number includes the CMA Fest cancellation. The city says yes. If you have tickets, they're good for next year, or you can ask for a refund. Nearly 2,400 coronavirus cases to report tonight here in Tennessee. Memphis and Nashville areas account for nearly half of those numbers. Other hotspots in our area, Sumner County at 184 cases, Williamson County with 131. There are 68 in Rutherford and 39 in Wilson County.
Italy is considered to be slowly inching toward decreased daily new cases. The ripple effects of COVID-19's punch, though, on the entire country earlier this month still results in hundreds of deaths every day. Just overnight, more than 800 coronavirus patients succumbed to the disease, pushing the country's death toll to now over 12,400. More than 105,000 patients continue to battle coronavirus. New cases only growing by 2.2%. That is the lowest increase percentage-wise since this whole crisis began. Now, this is the 3rd week anniversary of that nationwide lockdown. Officials are going to be extending it well into the middle of April. The city's coronavirus task force is acknowledging today what News 4 Investigates has been reporting for days. The city, of course, meaning Nashville here. The backlog in COVID-19 test results here in Tennessee is resulting in an incorrect real-time number situation about how far the virus has spread. Chief investigative reporter Jeremy Finley continues to press for answers.
The tweets keep coming to News 4 Investigates. This man writing, "I was just told 19 days for my test results by Vanderbilt." Tweet Your Heart Out writes, "She was tested on March 20th by Vanderbilt Walk-in Clinic. Still no results."
We're hearing a lot of complaints from people about how long it's taking to get the test results.
We put viewers' frustrations both to the city and Vanderbilt. Vanderbilt responding that at their in-house testing last week, they were out of necessary reagents, meaning supplies and chemicals, writing, "We were unable to keep samples moving through the process at the pace we had established. And even with those supplies back in stock, quote, our lab is working as quickly as possible to remove the backlog."
This is an increase of 98 cases in the past 24 hours.
And even the daily numbers given out by the city are now skewed. Listen to how the chair of the coronavirus task force acknowledges the impact of the backlog from private labs.
Some of the cases that should have been reported over the past several days are now being reported today.
And that new drive-through testing through the city, they say the results should be in between 5 and 7 days. But the coronavirus task force acknowledges even that could be impacted if the private lab they're using becomes overwhelmed.
The more they are tasked to do, there probably will be a longer delay.
Jeremy Finley, News 4 Investigates.
Hi, I'm meteorologist Lisa Spencer, and it is weather right here on my back deck today, and a deck I haven't used a lot today because of all the rain that we have had, but it has started to move out of here now. We've still got the clouds, but a few breaks here and there. Let's take a look over downtown, and we find our latest temperature coming in at 54 degrees. We've got that northwest wind at 14, so a little bit of a wind chill making it feel a bit cooler. 56 for you in Clarksville. We are much chillier over in Tullahoma, McMinnville in the mid-40s right now, and you can see see the showers we have remaining. This stuff is moving out of here. Livingston over to Cookeville getting a little bit of this rain. And the clouds, notice the back edge over in West Tennessee. That's going to be the clearing sky that we will see tonight, and that will have an impact on our weather. I will tell you though, for most folks, you're okay to be out and grilling tonight as we'll start to see this cloud cover move on out of the way. Temperatures will be in the upper 40s, but we are looking at a little bit of patchy frost perhaps by tomorrow morning. I'll tell you more about that and just how warm it's going to be over the next few days. That's just ahead.
All right, Lisa Spencer, thank you. In a jacket, no less, looking a little chilly.
She looked pretty snazzy.
Well, coronavirus cases has many industries, of course, rethinking how they do business, and that includes the housing market.
News 4's Melanie Layden talked to one Nashville realtor about how COVID-19 is impacting the busiest season of buying and selling.
Well, hey guys, yeah, that's right. Spring is usually the ideal time if you want to put your house on the market. But now these times of shelter in place, it's making things a little more challenging. However, real estate agents say people are still buying. They're just doing it a little differently now. Even the hot Nashville housing market is not immune to the impact of coronavirus.
So real estate has been designated as kind of an essential industry. Obviously, people need housing. We will see a drop-off in activity, period. But the silver lining for buyers and sellers is that people that are active in this marketplace are because they need to be.
Realtors are taking precaution to keep themselves, their clients, and potential buyers safe. They've already suspended public open houses and turned to virtual tours or online showings. And if a client does want to see a house in person, they're asking sellers to leave out disinfectant wipes to wipe down doorknobs, light switches, or surfaces that would be touched. As far as it being a buyer's market, realtors say that's still the case in Nashville. But because of uncertainty, there have been some potential buyers pressing pause.
Absolutely. There's a lot of like, hey, let's wait and see type of attitude.
But Checo says not everyone is in the same boat, and even though these times can be scary and uncertain, market trends are not slowing toward a recession.
I'd like to tell people right now, especially colleagues, when they're asking what I think, I just tell them to kind of keep an eye on new construction, especially big national builders. Those guys are going to make decisions that serve their business and shareholders first and foremost. And that can mean they'll be the first to drop prices. They'll be the first to stop in terms of new starts when they want to just kind of get a freeze on cash flow. And so far, we're not seeing that.
Yeah, and you'll still see a lot of active construction going on because those houses and buildings, they're already done deals. Also, the general perspective, too, is that this is just a brief period of time, hopefully, that things will be put on pause. Live in Nashville, I'm Melanie Layden for News 4.
Melanie, thanks. From the housing industry to the auto industry now, Nissan North America is using its manufacturing and engineering expertise to help fight against the coronavirus crisis. The company is 3D printing headbands and face shields to donate to local healthcare centers here in Tennessee. Nissan, along with other major automakers, suspended vehicle production in the U.S. earlier this month. The company says they will be able to produce more than 3,000 face shields by this Friday. After that, they expect to print and assemble more than 1,000 shields per week. Airbnb is extending its cancellation policy. People who book stays before March 14th with a check-in through May 31st are eligible for a full refund. Airbnb is also pledging $250 million to help support hosts who have had reservations canceled